Hi, I'm here with Tracy Plunkett, owner, Care Navigation and Advocacy. And Tracy has been with Pulse before doing presentation on her expertise of health insurance, something that really confuses a lot of people. We just don't know when we're supposed to check our health insurance. So I have a very specific question for you, Tracy. I'm hoping you can help with some knowledge about our health insurance. Let's use this example. A gentleman who's 84 years old, his wife is now blind. He has been taking care of her for a number of years, and now his own health is failing. So he came with the question of, what do I do? What could we suggest where it comes to health insurance? Can he check into his health insurance? Tell us what would happen with something like that.
Yes, he can. So he can call his health insurance coverage and find out what services. Many times home health care is available. Another thing that he could do is ask for a care navigator. Sometimes insurance companies have their own care navigators, their own case managers to help them navigate through their insurance system. But I would definitely start with the insurance coverage first. That is key.
So would this first step to be to see the doctor and get information or a prescription even?
Well, yes, you could, right? You could check with the doctor because they more than likely will have to do a referral. But again, there's nothing to stop a patient from calling first, even before they go to the doctor, and say, "What services do I have available to me under my coverage?" Then they can certainly go to the doctor and say, "Doctor, I have home health care services, so I need you to do a referral." Now, the one thing I will caution, the doctor may do a referral, but what I recommend, once he says yes, and find out who they work with, go back to the insurance company to make sure that that home health care agency is in the network. Because if it's Medicare and in the network, it's typically covered at no cost as long as they're in the network. So that is key. They've got to be in the network, and the insurance company can confirm that information.
What other things might be covered that we don't know about?
Sometimes insurance companies will have meals. So if people have certain chronic illnesses, they may be able to get meals delivered to them for X amount of weeks. So there are some insurance companies that are covering that as well. Some also offer transportation to doctor's appointments. That's another thing that insurance companies will add, especially in the Medicare Advantage space.
So a family member who wants to help their family or friend out, one of the things they can do is to sit with them, because the insurance company won't talk to a friend or family member without the patient's permission, but they could sit with them and make these phone calls and find out what the insurance covers.